Ever feel like you want to just get to the bottom of things?
Yeah.
Really understand the important stuff about complicated topics
Uh-huh.
without it feeling like you need to go to med school.
Yeah.
So that's exactly what we're doing in this deep dive today.
All right.
We're going to be zeroing in on arterial disorders.
Okay.
We've got some really, really great source material here that unpacks what's happening sort of beneath the surface.
Right.
And our goal with this is to connect the dots for you
Okay.
so that all of these things that seem like separate issues
Yeah.
start to make a lot more sense.
Absolutely. And I think...
When you see how they're all connected,
Uh-huh.
it really is pretty fascinating.
Yeah, it is.
And can be a little bit alarming, too, when you realize
Right.
the impact that these things have.
Uh-huh.
So we're going to be exploring the fundamental processes
Okay.
that can impact your arteries.
Right.
These are those vital pathways in your body, right?
Yeah.
This is the circulatory system,
The plumbing.
the plumbing. Yeah,
Yeah.
exactly. So you're going to come away from this with a really clear understanding of how problems can begin
Okay.
from the earliest stages of plaque development
Right.
to the more serious consequences that can arise
Yeah.
if these issues aren't addressed.
Uh-huh.
So think of this as your fast track to being well-informed about things like atherosclerosis.
Okay.
What's really going on there, the story with cholesterol,
Uh-huh.
the so-called good and bad types,
Yeah.
high blood pressure,
Right.
and then specific conditions like
Yeah.
abdominal aortic aneurysm,
Uh-huh.
aortic dissection,
Okay.
and peripheral artery disease.
Right.
And importantly, we're not just going to list them.
Yeah.
We're going to really show you how they can all be linked.
I like it.
So where should we begin at this exploration into this fascinating and crucial world of your arteries?
Well, I think a logical starting point is what the material calls the bedrock of many arterial problems,
Okay.
and that is atherosclerosis.
Okay.
Now, the material also refers to arteriosclerosis,
Right.
which is essentially the hardening and narrowing of your arteries.
Okay.
Atherosclerosis is a specific type of arteriosclerosis,
Gotcha.
and it's caused by the buildup of plaque.
Okay, so let's unpack this a little bit.
Right.
What is the actual process that leads to this hardening and narrowing in your arteries?
Well, it's a step-by-step process
Okay.
that kicks off with an injury to what's called the endothelium.
Okay.
That's the inner lining of your artery. So picture it like a tiny scratch on the inside of a pipe.
Okay.
This seemingly small injury triggers an inflammatory response,
Right.
which attracts white blood cells
Right.
or WBCs to come to the site of the damage.
Yeah, and this is where that often talked about bad cholesterol.
Yep.
LDL comes into play, doesn't it?
Precisely.
Yeah.
Low-density lipoprotein, or LDL,
That's
is
a-
responsible for transporting cholesterol in your bloodstream.
Okay.
When these WBCs arrive at that injured spot in the artery lining,
Yeah.
they start to engulf and ingest the LDL cholesterol. As they become overloaded with this cholesterol, they transform into what we call foam cells.
Foam cells.
Yeah. And here's an interesting point.
Okay.
These foam cells, the body's initial attempt at repair,
Uh-huh.
actually become the very first building blocks of atherosclerotic plaque,
Wow.
the very thing that causes the problem down the line.
But it's almost like the body's trying to fix something, but inadvertently starts something worse.
In a way, yes.
Okay.
Now, there's another key player in the cholesterol story,
Okay.
and that is high-density lipoprotein,
Right.
or HDL, often referred to as the good cholesterol.
The good cholesterol. Yeah.
One of HDL's main roles is what we call reverse cholesterol transport.
Reverse cholesterol transport.
Think of it like a garbage truck.
Uh-huh.
It picks up cholesterol, including from those foam cells,
Okay.
and transports it back to the liver where your body can then get rid of it.
So HDL is like the cleanup crew that takes out the trash.
Exactly.
Okay.
However, the material highlights a critical imbalance that can occur in your body. If your LDL levels stay high
Mm-hmm.
and your HDL levels remain low,
Uh-huh.
this reverse cholesterol transport system gets overwhelmed.
Right.
There's simply too much bad cholesterol for the good cholesterol to effectively remove.
That makes sense. So the plaque keeps accumulating.
Right.
But it's not just cholesterol that makes up this plaque, is it?
You're right.
There are other things involved.
The material also mentions fibroblasts.
Fibroblasts.
Think of fibroblasts as the construction crew that comes in after the initial damage.
Okay.
These cells are called to the injury site,
Yeah.
and they actually invade the smooth muscle layer of the vessel wall.
Interesting.
This invasion leads to the vessel becoming less elastic,
Okay.
a process we call sclerosis.
Sclerosis.
Oh, it's not just a fatty deposit. The actual structure of your artery wall changes,
Right.
becoming harder and less flexible, almost like an old rubber hose.
Okay, so to recap for myself,
Okay.
starts with a little damage to the artery lining.
Right.
LDL cholesterol shows up.
Ah.
White blood cells try to clean it up and become foam cells.
Yep.
And if HDL isn't doing its job well enough,
Right.
these foam cells stick around.
Uh-huh.
Then these construction worker cells, the fibroblasts,
Yeah.
come in and make everything stiff.
Yeah.
Got it.
Good.
Now let's dive deeper into this cholesterol topic.
All right.
You know, it often gets kind of a negative image,
Yeah.
but the material points out it's not entirely bad, right?
That's a crucial distinction.
Yeah.
Cholesterol is actually essential for a number of vital functions in your body.
Right.
It's a key component of your cell membranes.
Yeah.
It's necessary for producing bile acids that help with digestion,
Right.
and it's also a precursor for certain important hormones.
Okay.
So it's not about having zero cholesterol. It's
Right.
about having the right balance
Yeah.
and how it's transported in your body.
Right. So LDL is like the delivery truck
Right.
carrying cholesterol to your tissues,
Uh-huh.
including potentially to the walls of your arteries.
Yeah.
And HDL is like the return delivery. Right.
Carrying it away.
Back to the liver.
It's the transportation system that needs to be in balance.
Precisely.
Yeah.
And when there's an excess of lipids,
Okay.
which includes both cholesterol and triglycerides
Mm-hmm.
in your blood, that's what we call hyperlipidemia.
Hyperlipidemia.
The material clearly links hyperlipidemia to the development of atherosclerosis,
Right.
and as a result to a higher risk of cardiovascular disease.
Now, what's a bit concerning is that hyperlipidemia is often described as asymptomatic.
Right.
You might not even realize it's happening in your body.
Yeah, it's sneaky.
Yeah, it's sneaky.
It is.
But the material does mention some potential signs that could show up.
Okay.
Can you walk us through those?
Yes, and it's important to be aware of these, although they aren't always present.
Yeah.
Angina, which is chest pain,
Uh.
can occur when your heart muscle isn't getting enough blood flow,
Mm-hmm.
often due to narrowed arteries,
Right.
a myocardial infarction, or heart attack.
Heart attack is a more serious consequence of a complete blockage of blood flow to your heart.
Right.
The material also mentions xanthomas,
Xanthomas.
which are fatty deposits that can appear on your skin,
Interesting.
and xanthalads,
Xanthelasma.
which are similar deposits that occur around your eyes.
Okay.
You might have seen those little yellowish patches.
I think I might have seen those around people's eyes before.
Yeah.
So those could be a sign that something's going on with their cholesterol levels.
They can be, yes.
Interesting.
Another sign mentioned is arcus senilis,
Arcus senilis.
which is a grayish or whitish ring that can appear around the colored part of your eye, the cornea.
Okay.
Finally, the material connects hyperlipidemia to metabolic syndrome,
Right.
which itself increases your risk of stroke, diabetes, and other cardiovascular issues.
So even if you feel perfectly healthy,
Yeah.
these seemingly minor signs could be telling a different story
Yeah.
about what's happening inside your arteries.
Exactly.
So what can you do about hyperlipidemia? The material touches on some treatment approaches.
The primary goals of treatment are to lower your LDL levels
Okay.
and raise your HDL levels.
Right.
Lifestyle changes are fundamental,
Yeah.
including adopting a diet that's low in saturated and trans fats and cholesterol,
Uh-huh.
and engaging in regular physical activity
Right.
to help maintain a healthy weight.
So diet and exercise, those are always...
Those are always the first line of defense.
Yeah, first line. Yeah, absolutely.
Yeah.
And when those lifestyle adjustments aren't enough,
Right.
there are medications that can help, right?
There are.
The material lists a few examples.
Yes. Statins are a commonly prescribed class of medications. They work by inhibiting an enzyme called HMG-CoA reductase,
Okay.
which plays a key role in your liver's production of cholesterol.
Right.
By blocking this enzyme,
Yeah.
statins reduce the amount of cholesterol your liver makes,
Uh-huh.
which in turn lowers LDL levels in your blood.
Gotcha. So it's sort of like cutting off the supply at the source.
Exactly at the source, yeah.
Yeah.
Lovastatin is provided as an example of a statin drug,
Lovastatin.
bile acid sequestrants,
Okay.
and PCSK9 inhibitors are other types of medications
Uh-huh.
that can also be used to help manage your cholesterol levels.
It's interesting how these different medications target very specific processes in your body
Yeah,
to achieve the desired outcome.
it's remarkable.
Yeah, it really is.
Uh-huh.
Okay, so we've talked about, the buildup in the arteries.
Right.
Now let's consider the force that pushes blood through those arteries.
Okay.
Blood pressure.
Yep, blood pressure.
And the material then moves on to hypertension.
Okay.
or high blood pressure.
Uh-huh.
And it calls it a silent threat.
It does.
Why that particular description?
Well, it's termed the silent threat because
Yeah.
much like hyperlipidemia, many people with high blood pressure don't experience any noticeable symptoms
Right.
for a considerable period.
So they might not even realize that they have it.
Exactly. And meanwhile, the constant force of blood pushing against the walls of your arteries can cause significant damage over time.
Damage that they're not even aware of.
Correct.
Yeah. Scary.
It is.
So the material includes a useful classification table
Okay.
for blood pressure.
Yeah.
Ranging from what's considered normal
Right.
all the way to a hypertensive crisis,
Uh-huh.
clearly outlining the systolic and diastolic ranges for each category.
It's a good reference.
It is a good reference, so you can see where you might fall.
Yeah, absolutely.
Right, so normal is generally considered below 120 for the top number systolic
Right.
and below 80 for the bottom number diastolic.
That's right.
Then you have elevated
Uh-huh.
stage 1 hypertension,
Okay.
stage 2 hypertension,
Right.
and then the really dangerous zone,
Yeah.
hypertensive crisis at over 180 systolic and or over 120 diastolic.
That's when you need to seek immediate medical attention.
Yeah, you don't want to mess around with those numbers.
No, you don't.
Seeing those ranges really puts it into perspective.
It does.
Now, the material also differentiates between different types of hypertension.
Okay.
Can you explain that distinction?
Certainly the vast majority of cases, around 90 to 95%,
Uh-huh.
are classified as essential
Okay.
or primary hypertension.
Primary hypertension.
This means that the high blood pressure isn't a direct result of another specific underlying medical condition.
Okay.
And often the precise cause isn't fully understood.
So there's not necessarily something else going on that's causing it.
Right. It's more of a combination of factors.
Yeah.
Genetics, lifestyle, things like that.
Yeah, gotcha.
Then there's secondary hypertension,
Secondary hypertension.
which is caused by another identifiable medical issue,
Okay.
such as a tumor on the adrenal gland called a pheochromocytoma,
Pheochromocytoma.
which can lead to an overproduction of certain hormones
Interesting.
or problems with your kidneys.
Okay, so secondary hypertension has a more direct
Right.
and sometimes treatable
Mhm.
underlying cause.
Yeah, if you can address the underlying cause, you can often address the hypertension.
Right.
Yeah.
But essential hypertension seems to be more about a combination of your genetics
Exactly.
and lifestyle factors playing a role.
Yeah.
Now, the real worry with hypertension is the end organ damage
Right.
that it can lead to in your body.
Yeah, it can affect multiple organ systems.
It can. Yeah, it's not
Yeah.
just limited to one area.
No.
The material details some key areas that are particularly vulnerable.
Okay.
Let's start with how it affects your heart.
All right.
So what happens there?
Chronic high blood pressure places a significant and ongoing strain on your heart.
Okay.
The left ventricle,
Uh-huh.
which is the part of your heart responsible for pumping oxygenated blood out to the rest of your body,
Right.
has to work much harder.
Yeah, it's having to push against more resistance.
Exactly.
Yeah.
Over time, this increased workload can cause the muscle of the left ventricle
Yeah.
to enlarge and thicken,
Okay.
a condition known as hypertrophy.
Hypertrophy.
While initially it might seem like a stronger heart.
Yeah, you think, oh, big muscles. That's good.
Yeah, you'd think so, right?
Yeah.
But the blood supply through the coronary arteries might not be sufficient to meet the increased demands
Right.
of this enlarged muscle.
So it gets bigger, but it's not necessarily getting
it's not getting the nourishment,
the supply that it needs.
the oxygen it needs
Right.
to function properly.
So it's not actually stronger in a healthy way.
Not necessarily, no.
Yeah.
And that puts you at risk for ischemia,
It's ischemia.
which is reduced blood flow,
Uh-huh.
infarction, heart attack,
Heart attack.
and ultimately heart failure.
Okay, so it's a whole cascade of potential problems.
It is, yeah.
So your heart muscle gets bigger,
Uh-huh.
but not necessarily stronger in a healthy way that benefits you in the long run.
Unfortunately not.
What about your eyes?
Okay.
How does high blood pressure affect your vision?
The delicate network of blood vessels in the retina at the back of your eye
Okay.
is also susceptible to damage from high blood pressure. Over time, this damage to the retinal arteries can impair your vision.
Oh.
And in severe and untreated cases,
Yeah.
can even lead to blindness.
That's a really concerning thought.
It is.
Yeah, for your long-term health.
It's a major concern.
And what about your kidneys? How does hypertension impact them?
Your kidneys filter waste products from your blood
Uh,
through tiny filtering units called glomeruli.
okay.
High blood pressure can damage the small blood vessels within your kidneys,
Okay.
including the renal arteries that supply blood to them.
Right.
This damage can increase the permeability of the glomerulus,
Okay.
allowing substances that should stay in your blood,
Yeah.
such as a protein called albumin,
Uh-huh.
to leak through into your urine.
Interesting.
This early sign of kidney damage is called microalbuminemia.
Microalbuminemia. So the presence of protein in your urine
Yes.
can be an early warning sign that hypertension is starting to affect your kidneys.
That's right.
Interesting. What about your brain? How can high blood pressure impact that vital organ?
In your brain, chronic high blood pressure can weaken the walls of the blood vessels,
Okay.
the cerebral arteries,
Uh-huh.
making them more prone to rupture.
Okay.
This can lead to a hemorrhagic stroke,
A hemorrhagic stroke.
which is a serious and potentially life-threatening condition
Right.
where bleeding occurs within the brain tissue.
So that's obviously a major concern as well.
Absolutely a major concern.
And finally, the material mentions that hypertension also contributes to the development of peripheral artery disease.
Yes, it
How does that connection work?
Well, by causing damage to the blood vessels throughout your body,
Uh-huh.
including those in your lower extremities.
Right.
High blood pressure accelerates the process of atherosclerosis in these peripheral arteries.
Okay.
This contributes to the narrowing and hardening of the arteries in your legs and feet,
Right.
ultimately leading to peripheral artery disease,
Peripheral artery disease.
which we'll discuss in more detail shortly.
Okay, so we'll come back to that one.
We will.
It's all so interconnected, isn't it?
It really is.
The damage caused by high blood pressure seems to worsen the problems caused by the buildup of plaque we talked about earlier.
Exactly. It's a vicious cycle.
It is, yeah.
Uh-huh.
Let's move on to some specific arterial issues.
Okay?
First up is the abdominal aortic aneurysm,
Why?
or AAA.
The dreaded AAA.
What exactly is that condition?
An aneurysm is essentially a weakening in the wall of an artery.
Okay.
This weakened area can bulge outwards, much like a balloon.
Yeah, like a bubble almost in the artery.
Yeah, like a bubble.
Okay.
And it becomes susceptible to rupture,
Right,
which can be a catastrophic event, especially when it occurs in the aorta,
right.
which is the largest artery in your body.
The main pipeline.
The main pipeline, yeah.
Yeah.
So that's a big problem.
And the material highlights a key physical finding for a AAA.
Okay.
It's called a pulsatile mass.
A pulsatile mass.
Where in your body would you typically be able to find that?
The material indicates that a pulsatile mass is often located in your upper abdomen.
Okay.
Slightly to the left of the midline.
Right.
Because the aorta is such a large vessel carrying blood at high pressure.
Right.
This mass can sometimes be felt pulsating with your heartbeat when you're lying down.
Oh, wow.
And in some cases, it might even be visible.
You could actually see it.
You could, yeah.
Wow, okay.
So that's a pretty clear sign.
And this is where the critical warning about palpation comes in, right?
Absolutely.
Yeah.
The material strongly emphasizes no deep palpation.
Okay.
Should be performed if an AAA is suspected or hasn't been ruled out.
Right.
The risk of applying too much pressure and causing the aneurysm to rupture
Yeah, you don't want to do that.
is simply too high.
No.
It's a crucial piece of information for anyone
Right.
who might be assessing someone with this potential condition.
Definitely something to be aware of.
Absolutely.
Now let's talk about another very serious condition. Aortic dissection.
Aortic dissection.
How is that different from an aneurysm?
Well, while an aneurysm involves a weakening and bulging of the artery wall, an aortic dissection is a tear in the inner lining of the artery,
All right.
specifically between the tunica intima and the tunica media,
Okay.
which are two of the layers that make up the wall of your artery.
Right, so within the actual wall itself.
Within the wall itself,
Okay.
blood then flows into this tear,
Uh-huh.
often forming a hematoma or collection of blood
Okay.
within the wall of the aorta itself.
So it's not an outward bulge,
No,
but a tear within the actual layers of the artery wall.
that's right.
That sounds incredibly dangerous.
It is indeed.
Yeah.
It can cause sudden and severe pain
Right.
and requires immediate medical attention.
So if you're experiencing that, you need to get to the hospital right away.
Absolutely no delay.
Okay, now let's shift our focus to the arteries further away from your heart,
Okay.
in what we call the periphery of your body. We're talking about peripheral artery disease, or PAD. That's the primary cause of this condition.
The material states that the primary cause of PAD is the same process we've discussed before,
Okay.
arteriosclerosis and atherosclerosis,
Right.
but occurring in the peripheral regions of your body.
So not right around the heart.
Not right around the heart,
Okay.
meaning in the arteries outside of those that supply blood directly to your heart.
Right.
The coronary artery.
The coronary arteries.
Interestingly, it notes that PAD is often seen in people who have diabetes.
Oh, that's interesting. Why is that connection significant?
Well, diabetes can contribute to that initial endothelial injury we talked about earlier.
Okay, that little scratch on the inside of the pipe.
Exactly, that damage to the inner lining of your arteries that sets the stage for atherosclerosis.
Ah.
So this makes individuals with diabetes more susceptible to developing atherosclerosis
Okay.
in their peripheral arteries, such as those in their legs and feet.
So that's why we see such a strong connection between diabetes and PAD.
Exactly.
And what are the consequences of this reduced blood flow
Right.
in those peripheral arteries?
The main consequence is a reduced blood flow, particularly to your neck and lower extremities.
Okay.
A hallmark symptom of PID is intermittent claudication,
Intermittent claudication.
which you might experience as cramping pain or discomfort
Okay.
in the muscles of your legs.
Ah.
That occurs when you're active, like walking,
Yeah.
and is typical.
When you stop to rest.
That's a classic sign.
That sounds like a key indicator to be aware of.
Absolutely.
Are there other clinical signs or symptoms of PAD?
Yes. Besides intermittent claudication, the material mentions
Yeah.
that you might experience diminished or even absent pulses in the affected limbs,
Okay.
as well as a decreased sensation in your feet.
So like numbness or tingling.
Yeah, numbness, tingling, a feeling of coldness.
Gotcha.
Those are all signs that there's reduced blood flow to those areas.
And your body sometimes tries to compensate for this reduced flow, doesn't it?
It does.
The material mentions the development of collateral blood vessels.
That's right.
What's going on there?
In response to the chronic ischemia
Okay.
or lack of sufficient blood flow,
Yeah.
your body can develop new, smaller blood vessels
Right.
that branch off from existing ones
Uh-huh.
to try and bypass the blockages.
Interesting. So it's like creating little detours.
Exactly, detours.
Yeah.
This natural process is called angiogenesis.
Angiogenesis. Okay.
And these newly formed vessels create what we call collateral circulation.
Collateral circulation.
While these can be helpful in improving blood flow,
Yeah.
they may not always be sufficient to fully restore it,
Okay.
especially during exercise when your muscles need more oxygen.
So it's like your body is creating its own little detour routes around the traffic jam in your arteries.
I like that analogy. That's a good one.
Finally, what are the treatment strategies for PA
Okay.
that the material mentioned?
The treatment approach for PAD focuses on managing the underlying atherosclerosis
Okay.
and improving blood flow to your limbs.
Right.
This includes making dietary changes to reduce cholesterol intake, taking medications to help control your blood pressure and cholesterol levels.
Okay, so those things that we talked about before.
Right, the same principles apply.
Yeah.
Achieving and maintaining a healthy weight. And crucially, quitting smoking if you are a smoker.
Yeah, smoking is so bad for your arteries.
It's terrible for your arteries,
Yeah.
as smoking severely damages your blood vessels.
Yeah.
The material also specifically mentions walking as a form of treatment.
Walking as regular exercise can help to promote the growth of those helpful collateral blood vessels.
Oh, interesting. So it actually encourages your body to build those detours.
Exactly.
Wow.
Yeah,
okay.
so get out there and walk.
It really does all come full circle, doesn't it?
It does.
Atherosclerosis, driven by factors like high LDL and low HDL cholesterol,
Can contribute to hypertension.
Yep.
Which in turn can further damage your blood vessels and contribute to conditions like triple aortic dissection and PAD
right.
in various parts of your body.
It all comes back to that initial insult to the endothelium.
It does.
That sets the stage for so many problems.
The truly interconnected system.
It is.
Where problems in one area can have ripple effects throughout your circulatory system.
Exactly.
That's a critical insight to take away.
It is.
You know, these aren't isolated health issues.
No, they're not.
The underlying processes, particularly atherosclerosis,
right.
can manifest in different ways depending on where in your arterial system they occur.
Exactly.
Understanding this interconnectedness is crucial for you to appreciate the potential consequences of things, like high cholesterol, high blood pressure on your overall health.
Absolutely.
And while we've covered a significant amount of information today,
we have.
This deep dive really underscores the importance of understanding these mechanisms for proactive health management.
It's about prevention.
It is, yeah.
Uh-huh.
And while we're not giving any medical advice,
of course not,
being well informed empowers you to make healthier lifestyle choices.
Yes.
and to have more informed and meaningful conversations with your healthcare providers about your own health.
Absolutely.
Exactly.
Knowledge is power when it comes to your health.
Knowledge is power. Yeah, I love that. So as you go about your day, I want you to consider this. How seemingly small changes at a cellular level, like that initial tiny injury to the inner lining of an artery that we talked about at the beginning, can have such significant and widespread consequences.
It's remarkable.
On your circulatory system over the long term.
It is.
It really makes you think about the intricate workings of your body.
Yeah.
And the long-term impact that your daily lifestyle choices can have.
Every choice matters.
Every choice matters, yeah. Thanks for taking this deep dive with us.
My pleasure.
I always learn so much from these conversations.
Me too.
And I hope our listeners do as well.
Expert.